our skies begin to clear. Temperatures cool tonight, and tomorrow a brighter day with highs just near 30 degrees.
Thank you, Steve. Congressional leaders will be looking for sources of revenue as battles over deficit reduction, the debt limit, and entitlement reform heat up. But could Obamacare become a place where Congress actually goes to hunt for dollars? Politico health care reporter Paige Winfield Cunningham joins us now with more. Good morning to you, Paige.
Great to be here.
So the president's health care reform calls for spending lots of money in the next decade. I mean, we're talking, what, 1.7, what is it?
As much as $1.7 trillion.
Trillion, okay. So I guess members of Congress are now looking at that as a pot of money, as a, hey, let's go after it?
Yeah, well, normally with the health care law, most people talk about the requirement to buy health coverage and the coverage for young adults, but what they kind of forget is this law dishes out a lot of new spending. Like you said, nearly $1.7 trillion. That's money that's already been set aside to be spent. But it's such a large sum of money, it's pretty tempting for lawmakers in these tough fiscal times as they're looking for ways to fund other projects or reduce deficit spending. So there's a good chance that this is some money that they're going to look at this year as they're trying to fund other projects.
And you say Democrats have actually already tapped into the health care fund?
They have a couple times. Of course, if it was up to Republicans, they would repeal the whole law, and they're always anxious to chip away as much as they can. So they've often suggested dipping into the Democrats, however, have only agreed when there have been other priorities that they want to fund. And yes, that's happened on at least 4 occasions. They have twice actually increased the amount of money that those who receive subsidies to buy insurance will have to pay back if they receive too many subsidies. The law provides help for lower income Americans to buy insurance, but if their income changes in the middle of the year, perhaps they get a raise or a bonus, they might end up accidentally collecting too many subsidies. The law requires them to pay some of that back, and lawmakers have twice raised that amount. Couple other things that lawmakers have dipped into, they've cut funding for the public Health and Prevention Fund. They've cut about 1/3 of the funding out of that to pay for other priorities. And again in December, they cut funding for nonprofit insurance co-ops. That was to pay for avoiding a drastic Medicare cut. So they've already done it a couple times before.
Okay, now explain this blended rate that President Obama has suggested. What's that all about, and are Democrats on board with that?
Yeah, he has suggested it. Some Democrats are pretty worried. Basically what it would do, the end effect would be it would cut Medicaid reimbursements for the states. Right now, the federal government uses several different formulas to calculate how much money the states get to help with their Medicaid programs. This would combine all of those formulas into one rate, thereby cutting the reimbursement. So that would be one thing that lawmakers could do to try to extract funding to use for other things.
I guess what most Americans probably want to know about the Health Care Act is what's it going to do for me? And we've already seen one provision kick in where you can keep your kids on your health plan after they're 22. What are some of the other measures that are going to kick in? Because everything's sort of staggered, right?
Yeah, absolutely. And this is a huge year for it because October 1st is a big deadline for the states. A huge part of the law is these insurance exchanges where Americans are going to be able to go obtain health insurance. If your income is at 400% or less of the federal poverty level, you will qualify for subsidies, potentially if your employer doesn't offer affordable coverage. About half the states have decided to run their own exchanges. The federal government is running the rest, but they have only about 9 months until they need to show that those exchanges are up and running. And then, of course, we're a year away from the 2014 deadline where most Americans will be required to obtain health coverage. And then many of them will be going to these exchanges.
All right, lots to look forward to. Paige Winfield Cunningham, thanks so much, healthcare reporter for Politico. And for the latest political news anytime, you know you can always head to Politico.com.
The Politico Minute is brought to you by Fairfax Kia.